Good afternoon and welcome to today's Caregiver webinar, Supporting a Loved One Living with Mental Illness. My name is Delalia Watson and with the Department of Family Services. Before I introduce today's speaker, I will go over a few housekeeping items. You should have received an email this morning with the speaker's slides, so you have them for your future reference. We will also allocate a few minutes at the end of the presentation for you to submit your questions by typing in the question and answer box in the Zoom panel. We have enabled closed captioning. If you would like to use subtitles, please enable closed captions on your Zoom panel. Today's presentation is being recorded, and a recording will be sent to all registrants by early next week. There will be a brief survey as you sign out, so please help us by giving us your feedback. Now it is my pleasure to introduce today's speaker, Lyn Tomlinson. Lyn Tomlinson is the Deputy Director for the Fairfax Falls Church Community Services Board. In this role, Ms. Tomlinson oversees all clinical services delivery for individuals with developmental delay or disabilities, mental health conditions, and substance use disorder. Ms. Tomlinson holds a graduate degree in education with a focus on community agency counseling. She began her career with the CSB in 1994. Lyn Tomlinson is going to share her expertise with us today. At the end of Lyn's presentation, Rebecca Kenslin will share some resources from NAMI. Thank you, Lyn and Rebecca, and welcome.
Thank you. Good afternoon, everyone. Thank you for taking time out today to join this very important presentation. So as we discussed today, we are talking about caring for a loved one with a mental health condition. And we're going to provide some background on what is a mental health condition, as well as how it impacts our community and how to care for a loved one to include during a crisis. I really appreciate everybody's time and attention, and we'll go ahead and get started. So what is a mental health condition? So mental health and substance use disorders affect people of all age groups and demographics. These illnesses are common, recurrent, and often serious, but they are treatable and people do recover. Mental health conditions involve changes in thinking, mood, and behavior, and these disorders can affect how we relate to others and how we make choices. Reaching a level that can be formally diagnosed often depends upon a person's reduction in ability to function as a result of their disorder. Mental illness. Serious mental illness is defined as someone over 18 within the past year having a diagnosable mental, behavior, or emotional disorder that causes serious functional impairment that substantially interferes with or limits one or more major life activities. For people under the age of 18, the term serious emotional disturbance refers to a diagnosable mental, behavioral, or emotional disorder in the past year, which resulted in a functional impairment that substantially interferes with or limits the child's role in functioning in family, school, or community activities. Substance use disorder. Substance use disorders occur when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at school, work, or at home. So let's talk for a minute about what are some common mental health conditions. One is a condition of mood, which is depression. Another, which is also a condition of mood, is bipolar disorder. Schizophrenia is frequently thought of as a thought disorder where people experience impaired reality, and anxiety is a case of individuals with extreme, some people might call it stress, but other people, it's experienced in a very different way, and it causes impairment in one's ability to function. A co-occurring disorder is when a mental health condition exists with the substance use disorder, and those are fairly common. So what is the impact of mental health conditions on our society? In 2020, there were an estimated 14.2 million adults in the United States with a serious mental illness. This number represents 5.6 of all US adults. This number does not include individuals with AMI, which is any mental illness, but this is pretty staggering in that 5.6 of all US adults have a serious mental illness. In terms of kids, 1 in 3 youth live with a mental health condition, and this is cited by both the National Alliance of Mental Illness and Mental Health America. So what are some common signs of mental health conditions? Common signs of mental illness in adults and adolescents can include the following: excessive worrying or fear, and that could be perhaps some of the paranoia that might be in a thought disorder, or it could be related to anxiety. Feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability or anger, avoiding friends and social activity, and changes in sleeping habits, feeling tired or low energy. And the changes in sleeping habits could mean either sleeping too much or sleeping not enough. Other signs include increased hunger or lack of appetite. Some people overeat, some people don't eat, causing weight loss or weight gain. Changes in sex drive, difficulty perceiving reality, which can be referred to as a delusion, which is I'm thinking something that isn't in reality, and really it can be very fixed, meaning there's just really no way of talking me out of it, and I continue to believe this even if there is refutable evidence to the contrary, or hallucinations, meaning I'm seeing or hearing something that other people aren't. Some people, and you may have heard the term self-medicating, overuse substances such as alcohol or drugs, which people do report provides temporary relief of some of these symptoms. Multiple physical ailments without obvious causes, such as headaches, stomach aches, or pains. Some people do think of or make a plan about hurting themselves or dying by suicide. Inability to carry out daily activities or handle daily problems or stress, and intense fear of weight gain or concern with appearance. One thing to say in terms of a mental health condition is that often there might be a medication prescribed that might cause some weight fluctuation. So that could be actually, a fear that really does make some sense. So youth mental health. Symptoms in children may include the following. There might be some changes in school performance. There might be excessive worry or anxiety. For instance, fighting going to avoid bed or school. Sometimes children can be hyperactive or have nightmares, perhaps have frequent disobedience or aggression, or refusing to comply with basic things that previously were not a challenge. And there might be some frequent temper tantrums. So we've just really laid before you quite a bit of information about mental health issues, and it's very important to make sure to involve a professional, which could be your primary care physician, in looking at this, because some of what was described could be a brief period unrelated to a mental health condition, or it could be the beginning of a mental health condition. So anasagnosia definitely impacts many individuals who have a mental health condition. And anasagnosia means someone is unaware of their own mental health condition, or that they can't perceive their condition accurately. So for example, if trying to talk with someone who has a thought disorder, sort of describing that perhaps some of their what they're seeing or hearing that might not actually be there, they would say that, yes, it is, and they may not have a logical response to that, but that's part of anasagnosia. And it's a common symptom of certain mental health conditions, and really it's very difficult to understand and can be very frustrating for loved ones as well as for the individual themselves. So how many loved ones are impacted by mental health conditions? There are a staggering 8.4 million people who provide care to a loved one with a mental health condition. Caregivers of adults with mental health or emotional issues spend an average of 32 hours per week providing unpaid care. That's quite a lot. In talking about some of the experiences of individuals with a mental health condition, many caregivers also become stressed and have challenges to include headaches and digestive issues as well. So how does one care for a loved one with a mental health condition? Truly, the idea is to care for yourself first. There is, and this is later in the slide, but that thing that we hear on the airplane about how I need to put on my oxygen mask first, because if I pass out from not having enough oxygen, I can't put anyone else's on. Loved ones of family members with mental health conditions frequently experience guilt. Is this my fault? How can I have a good time when my loved one is suffering? These are very normal experiences. And they're also very painful and can be very isolating. Family members also can experience a great deal of stress and anxiety and can have a startled response to a ringing phone or a text message because people can be really on edge waiting for the next shoe to drop. We talked about some of the physical problems family members can have. We talked about the isolation, and also family members can be reluctant to talk about their loved one's mental health condition. And this is why Rebecca is on the panel to talk about some of the community resources. Part of the challenge for a loved one caring for a mental health condition is not just the exhaustion of caring for someone, but it's also the isolation and the sometimes anticipatory grief in terms of feeling, gosh, before someone, developed schizophrenia, what was happening in their life, and then feeling that that's not going to happen and just how painful that is. So we talked about self-care and putting your oxygen mask on first. Also finding support. NAMI family-to-family programs are useful for education and networking, and I know that Rebecca is going to talk about that more. There's also support groups for family members. One other thing to consider is that if you are working outside the home and outside of your caregiving, to pursue the Family Medical Leave Act with your employer to care for your loved one. That way your job is protected and you may be able to use leave from your employer to care for your loved one. So how can I support my loved one? Once again, you'll see take care of yourself. If you don't remember anything else from this presentation, please do remember the importance of taking care of yourself. In terms of supporting your loved one, it's important to set and maintain boundaries and not say anything to which you're not able or willing to commit. Totally understand how exasperating things can be. And sometimes people have said, you can't live here if X, and then the person turns around and says, well, of course you can live here. And that really sends a mixed message. So really encourage people to set and maintain boundaries, and at the same time, not say something that you're not able or willing to commit to. One thing to consider also is to ask your loved one what they would want to happen if they were to need additional support. Some people may have a preference about the type of care they would like or from whom. So sometimes people say, okay, I'll go to this hospital, but not that hospital. Certainly, I understand, particularly with Anasagnosia, that this may not be able to happen. And if you can know in advance, that's helpful. Sometimes people develop what's called a RAP plan, a wellness recovery action plan. And that actually, in that plan, it does say what the person would like. So if they're willing to share that with you, if they are in some kind of service, that would be helpful. Another thing to consider is the use of language and how important that is, and it contributes to addressing stigma and treating everyone with treating people with dignity and respect. So we do like to refer to people as having a mental health condition or living with a substance use disorder, as opposed to I've heard people refer to someone as, Lyn is a schizophrenic or so-and-so is a manic depressive. And really it's living with a mental health condition or a substance use disorder. One thing that can also be helpful is to remember that the individual likely would not have chosen this condition. And I realize how difficult it can be, and this is hard to remember, and it can be important to remember this. And the other thing is to enjoy the good times and celebrate the victories, whether they're large or small. So we have a variety of community resources for people. One is our CSB Emergency Services. I realized that I did not say what the CSB is, and the CSB, the Fairfax Falls Church Community Services Board, is a behavioral health and developmental disability service provider. We often think of ourselves as the behavioral health safety net for people. Many of the individuals we serve are very impacted by their illness, both their mental health condition and their substance use disorder. Some people have commercial insurance, some people are uninsured, and some people have Medicaid. So CSB Emergency Services is open 24 hours per day, 7 days a year. Excuse me, the opposite of that. So open 24 hours per day, all days of the year. And the phone number, which anyone can call, is listed here, or people can walk in. So those are two options for folks when there's an emergency. An emergency could also be a crisis. So if you or your family is in crisis, you certainly can call. We also do have two mobile crisis units. And I specify that we have two because sometimes people call and we're not able to get there as quickly as we would like or as the person would like. And that's because we have just the two units to cover the entire county right now. Also, there are some hotlines to include 988, which is the 24/7 crisis and support. That started just last month for everyone. And one of the local numbers is actually right in our area as well. So that is available for people to call. And then also the NAMI National Hotline, which is open from 10 a.m. to 10 p.m., which I think that Rebecca will talk more about. Other services we have at the CSB here at our Merrifield, or excuse me, our Sharon Boulevard Community Health Center, which is at 8221 Willow Oaks Corporate Drive, is we do have walk-in access. So individuals can come in and be seen for an assessment or for a screening. We are not able, unfortunately, to serve all of the individuals who come in to us, but we do have many community partners and we can refer people there. One of the questions that I do get frequently when I talk to communities is how can I communicate with my loved one's provider? And if you've had this experience and your loved one has not provided information, you may hear that the person that you're calling cannot confirm or deny if someone is in service with them. And that is because that is a legal requirement that we all must uphold. However, what we can and should do is we should always be able to listen, even if we cannot confirm that the person is in our care because they haven't given us their permission. And there's a variety of ways that you can share that information. You certainly can call the provider and share it verbally. You can provide them with some documents. And that would be helpful. The other thing is when individuals do decline to give us permission to speak to people, depending on the person, we may revisit that so that it's not just kind of the person said that no, they're not going to do that, and then we're not going to talk to their loved one again. It really is helpful for us to have family input because often, not often, but families see way more of the individual than we do and can certainly provide some very helpful information for the loved one's care. So there are also here some additional resources that you may want to peruse when you have a moment. One thing I would like to do is go back to the crisis slide, which of course now I can't find, my apologies. But if there is a danger in your home and you're feeling like your loved one may hurt themselves or someone else, please do call 911 and ask for a crisis intervention trained officer. Law enforcement in our community has been trained in how to deal with individuals experiencing behavioral health and developmental disability conditions. And if a crisis intervention trained officer comes to the scene, they may have other resources as opposed to arresting the individual, and may be able to offer some help for the individual. So now Rebecca will speak from NAMI, and Rebecca and I did collaborate on our presentation, and we do have some of the same similar information. So Rebecca will probably skip that piece of her presentation and then share information about NAMI. And then, of course, we do look forward to your questions. So thank you. I'm going to stop sharing and put myself on mute.
Thank you so much, Lynn. My name is Rebecca Kiesling, and I am the Executive Director of NAMI Northern Virginia. So we service here at NAMI Northern Virginia the areas of Arlington, Alexandria, Falls Church, all of Fairfax County and Loudoun County. So about 2 million people in about 1,000 square miles. We are an affiliate of NAMI National, which is based in Arlington. So we get kind of the best of both worlds. There are over 600 affiliates, both state and the local like we are, throughout the country. And a lot of the information that Lynn mentioned is from our national organization. I'm going to start sharing my screen right now. I hopefully got all of the duplicate out. There we go. Yeah, I really loved how Lynn talked about the language of, talking about to someone who is dealing with a mental illness. There's a great book out right now by Dr. Thomas Insel. It's called Healing: Our Path from Mental Illness to Mental Health. And I talk about this book a lot. I think it's wonderful, but he really goes into where we've been to hopefully where we're moving to. And talking about someone, and we talk about this, people who deal with mental health concerns. And to not go into more detail of what Lynn said, there are more people in Virginia that than ever before had never said they experienced depression or anxiety ever, and now since the beginning of the pandemic say that they have. Those are mental health concerns, and those are things that we should all take seriously. And what we offer at NAMI Northern Virginia goes beyond treatment, because we aren't providers, we are not mental health practitioners, but what we offer in terms of services is hope. And I'm going to go into that a little bit more in just a minute. But to add on to what Lynn said, she went into such great information about what mental illnesses are and also what mental health concerns look like. But something I want to talk about really quickly is trauma. And that's something that we need to take seriously. And some of people don't quite understand. Trauma is an emotional response to terrible events. But what people don't understand is that it doesn't have to be necessarily something that a person experiences firsthand. And most people will experience a traumatic event. It can be direct or an indirect exposure to this event. Most people are going to experience an acute negative response to some traumatic event once or twice or 3 times in their life. But for the most part, this negative response goes away. We talk about ACEs, and you might have heard of this before. ACEs are responses that happened to young people in their childhood. There's the joke, you're going to put your child in therapy. Well, these are actually things that we have seen through numerous research that if a child experiences one or more of these life experiences when they are children, they do have there's more chance that they will show physical or mental concerns related to these when they become adults. And those can be physical, emotional, or sexual abuse, neglect, a family member who has mental illness, an incarcerated relative, observed or experience domestic or community violence, divorce or separation, substance abuse in household. Now, there's a lot of different kinds of trauma. There's that acute traumatic response. So a short-term negative symptom that you might have usually resolves in a couple of months, and most of us experience something like this. But there's also the longer term response. There's something that you might not notice right away, or a person might not notice right away. It's something that you might experience 3 or more, or even years afterward. These are the things that you hear about called PTSD, or might show up as an anxiety disorder. Some people even have survivor guilt, and we hear about this very often in terms of, you might have heard PTSD in terms of someone who comes back from war, but we've also heard about it in terms of some of the more violent attacks in the US recently. So where does this come in what we're talking about today? Some of it is what we have talked about in terms of stigma. Some of it, we're trying to move away from stigma necessarily, because what people are experiencing in terms of mental illness or mental health concerns is really, it's bias, it's discrimination. And this is a quote that I have on my screen from a executive director in one of the NAMI states. And she says, perhaps it's time to use the word stigma more sparingly, if at all. In reality, what people with mental illness are facing is not stigma, it's discrimination. The word stigma doesn't truly reflect people's experiences with discrimination in housing, in education, employment, and healthcare. It's not stigma that has resulted in people waiting in emergency rooms. It's not stigma that has resulted in public and private health insurance not covering needed mental health treatment and services. So we see this in terms of a lot of the work that we do. Now, Lyn went into some of this today. There are so many different treatment options for people with mental health concerns and mental illnesses. I'm not getting into all of these. This isn't what we do here at NAMI, but it really is. It's a lot. It's overwhelming. And when we look at all of this, all of these are, it sometimes feels like you don't know where to turn if you're supporting somebody that is dealing with a mental health concern, because all of these are coming at you and you don't know where to turn. And we talk about trauma in terms of the secondary traumas. These are what come from people who, whether you're the person who is going into recovery, when you have to start making these treatment decisions, you're expected to understand all of the side effects of your medication, or you're someone who's trying to help someone in recovery. It's exhausting. You feel a lot of responsibility. So where do you turn? And that's where we come in. So NAMI Northern Virginia and the other affiliates like us have a variety of different programs to help people who not only are moving into recovery, but are also helping to support people who are either in crisis or are in recovery. Our support programs are a couple fold. Now, number one, we're all peer-to-peer led. So these are people who have been where you are. Our connection groups are led by peers who have been trained as peer leaders. But our connection groups are peers who have been in crisis. They have been through the system. They're in recovery and they want to help. And those are support groups that you talk about what's going on and how to keep going on and what services are available to you. So all of those secondary traumas, we're not offering therapy, but to hear from peers, to be part of those groups, When we move into the family to family, we have family support groups, we have family classes. When we're talking about what to expect, how to talk, what language to learn, it's a lot of information. The classes are 8 and 12 weeks, and those classes can help family members and loved ones. So it doesn't necessarily have to be a brother or a sister or a mom or a dad, but loved ones. Go through and help learn how to support yourself while supporting those people that you love. The support groups meet when you want to meet. So you can be part of a support group that meets both virtually or in person. I meet with a support group in another state, but these support groups are varied. So they might be very specific. So a family member who has an adult going through crisis or dealing in recovery, they can be more broad. And you find one that works for you. We have support groups all over our area, and they meet both in person and virtually now since COVID. And we try to help you find one that matches what your needs are. Our educational programs are really built to start breaking those stigmas that we spoke about. Ending the Silence is more youth-based. There's an adult and a young person. We try to, our leaders, our facilitators of these aren't under 17 years old, but we do these programs in middle school and above to talk about what it looks like and what it feels like to have a mental health concern or a mental illness. In Our Own Voice is definitely more adult-based. There are 2 leaders, 2 facilitators, and they talk about what it is to have a mental health concern. These are people who might have been in inpatient treatment, but also what it feels like to help support those same people. And then Mental Health 101 is what it sounds like. It's a lot of what we talked about today, but in a shortened format, and how to support not just yourself, but those you're in a relationship with. We have done these programs in businesses to help teammates support other teammates who might have a mental health concern. And we're also advocates. Now, advocacy doesn't have to be petitioning on a lawn of an elected official, but what it can also be is helping make this is advocacy, what we're doing here. Advocacy is education. Advocacy is trying to make the mental health system a little bit better. We can all be advocates, and it really is part of the recovery process. Talking, breaking down the walls, those are all, it doesn't have to be big A advocate. It can be little a advocate. And then our helpline. Lyn was great to put up the national NAMI helpline. We also have a helpline, and the hours are the same. What our local helpline does is it can help you connect to local resources. So the volunteers and staff people that run our helpline, they know, they've been where you are, but they also know the local resources to help you connect to. So if you're looking for something specific, whether it's an incarcerated family member, a recently incarcerated family member, or someone that you're looking for private treatment for, our volunteers know everybody that's out there, and they want to help you. So I encourage you, if you're looking for help, contact the helpline. They're not a therapy line, but they are a resource line. And there's our information. I'd love to help in any way that I can. We are currently, and I think we'll stay that way, as a hybrid office. So you're seeing a little bit of my living room. But our support groups and classes are all over Northern Virginia, throughout Loudoun County, in Fairfax County, in both Alexandria and Arlington. And that's all I have.
Thank you so much, Lynn and Rebecca. And at this point, I'd like to invite our audience to submit their questions. Please use the Q&A box and I will read your questions to our presenter as they come in. We have a number of questions here, and I'll go ahead and read them out to our presenters. The first question is, do you have to live in Fairfax to take advantage of the CSB, either by phone or walk-in?
So thank you. I'll take that question. Yes, the Fairfax Falls Church Community Services Board serves Fairfax County as well as the towns of Herndon, Vienna, the city of Fairfax, and the city of Falls Church. There are CSBs across Virginia. So Loudoun County has their own, Arlington, Alexandria, and Prince William. If you're not sure about where, how to contact them, our entry and referral office can connect you with them, and we can get that number out to everyone.
Thank you, Lynn. To our next question. What are your thoughts on medical marijuana use as part of treatment for diagnosed bipolar disorder or PTSD?
So that is really a very challenging question. I would share that part of what I should have said when I was beginning my presentation is that I don't feel comfortable telling someone what they, should be doing. And so sometimes people have said, gosh, this really works well for me. What I would say, though, is that we have seen people who have shared that that is not something that works well for them. And so I'm sorry to not be giving a more crisp answer. However, it's a very big question, and I would really encourage the person, if they have a provider, to talk to their provider. One thing I do feel comfortable saying is that I wouldn't see how that could be the only treatment for someone who has bipolar disorder. So would really encourage the person to talk with their provider. The other thing I would share is that depending on where the person is getting their cannabis, would want to make sure that there is not anything else in the cannabis, because in the community, we have seen that there's other drugs that have been in cannabis recently. So that is a concern. I'm sorry that's not as crisp of an answer as you'd like, but that is truly a big, big question.
Thank you, Lynn. Our next question is, how do I become involved in trainings on mental health or certifications that would allow me to take up a position and support those in need?
Please, Rebecca, that is right up your alley.
Absolutely. We would love to have you join us and be part of our support groups or classes, or a presenter at one of our presentations. I encourage you to email info@nami-nova.org, and we'll get you in touch with Esther. We are definitely looking for people to join us. I say we're small but mighty. We have over 2 million people that we need to help, and all of our services are free. And that's something I should enforce. Everything that we offer is at no cost. So we are looking for as diverse and mighty a force, and all of our peers and our presenters are trained, and we'd love to have you.
And if I may, before we go on, I was remiss in not mentioning two things. One is that if someone goes to the Fairfax Falls Church CSB website, you'll see that people can sign up for mental health first aid classes. And those are just like first aid classes for if I fall and break my ankle, and really helping people to understand how that they can help. And also for our project Revive, which is where people learn how to, lay people can learn how to administer Narcan, which is the opioid reversal drug. And in addition to learning about Narcan, can actually receive Narcan. So people can get that from us for free. I also should have mentioned that a very important part of our treatment services are our peer support or our peer recovery specialists. And those are individuals who themselves are in recovery, who work with the individuals we serve. We also do contract for staff who are family support partners. And that's just what it sounds like in terms of staff who have been through the experience of having a loved one. And these are for our youth, but working through the system with getting individual services, answering questions about the individualized education plan, and just really providing some of that navigation and hope. So thank you for those questions.
We have a comment here, and it's saying living in poverty can also be considered as an ACE. I don't know if you want to
Absolutely.
share some light on this.
Absolutely. That list, and I apologize, that list definitely was not exhaustive. There are more ACEs than that. And on top of that, there's other research that says if you have one or more, you're more likely to. For time, I did not go into that further. That is not an exhaustive list of ACEs. There's also other ACEs that we could talk about in terms of generational issues. There's ACEs in terms of racism. There are a lot of other ACEs that we could mention, and I didn't. And I encourage you to read about that. You can look it up, and you could also you know, that trauma and those other things that impact people when they become adults that you might not understand where it comes from. It's powerful. It's powerful to learn as someone who is talking about this, but it might be powerful for others to learn where a person that they care about, their trauma is coming from. So I encourage you to learn about that.
We have a question asking for your opinion, and it reads, how can we talk about, learn from, or prevent what happened to just Lynch, especially when encouraging people to contact police during a mental health crisis?
I can start with that, and maybe, so Lyn I'm thrilled that Lyn went back and talked about the CIT officers. What we can do is continue to enforce the importance of trained law enforcement officers in crisis response. That's what we can do. We do have these resources, and we've been, NAMI's been partnering with law enforcement for years on the need to train law enforcement on the difference between, a person who is violent to be violent and a person who is going through a psychotic break or whatever they're dealing with. There is a difference. And the more that we can enforce that, and that we can also tell people that is an option, that they can and should call 911 and request a CIT officer. That's the best that we can do, and we have to do it. We have to educate. We're so fortunate in our county, and I live in Fairfax County, to have mobile crisis response units. We don't have enough. And that, as a citizen, we can do. As citizens, we can advocate for more money, for more mobile crisis response units, and more trained CIT officers. That's what we can do.
And if I can also add, one of the things that we are currently piloting is what's called the Corresponder Model, where we have our mental health clinicians actually riding with law enforcement, responding to behavioral health concerns. So that's absolutely another thing that we can do. We are working to get that further across the county than it is currently. Right now, it's a very small number of people, but we are really working to make that much bigger than it is. So thank you very much for that question.
Thank you, Rebecca and Lynn, for shedding light on that. Regarding the question on today's recording, yes, we will send out a copy of the recording early next week. And we have another question, and it says, okay, that question is regarding the slides. Yes, the slides were sent out earlier this morning by email. And another question is, will the NAMI slides, will the NAMI slides be available? Yes, we emailed the slides before the webinar.
I don't think my slides were, so I will send those. I'll send those to you all, and it's my fault. Sorry.
Okay, thank you. Okay, so I guess this question is for Rebecca. Are there any training programs available to teach some skills for mental health, mentally ill patients?
So we do have classes directed for people who are going into recovery, as well as we have support groups. We call them connection support groups, and those are for people who deal with mental illness or mental health concerns. It's something that we are very proud of, and they are peer-led. If people are looking for therapy or for a professional-led peer or support group, that isn't through us. We're happy to connect, either through CSB or through other services, and we can help connect somebody with those services. But what we do is we do peer-led group support and classes.
And if I could also add, thank you, Rebecca, that our CSB buildings also have peer support or wellness centers. So here at our Sharon Bulova Center, we have a program. There's also one in our Reston site off Cameron Glen. There's one at Heritage, which is in Annandale. And then at Sacramento, down in South County, we have one. And exactly what Rebecca said, these are centers run by individuals who themselves are in recovery. And really, it can be whatever the individual coming in would like it to be. Meaning if the individual just would like to sit down and have a cup of coffee, they certainly can. They can come in and use the computer. They can get assistance with writing a resume. And we also have peer-run classes. So I can get that information to get sent out to everybody on this call as well. One of the things about doing an hour-long training is that it's so hard to fit everything in. So I'm so grateful for all these questions, and we can certainly get to you what it is that you need.
Thank you, Lynn and Rebecca. The next question, does the CSB have access to residential treatment centers for people suffering from dual diagnosis of mental illness and substance abuse?
Yes, we do. Thank you for that question. We have several programs. We have a New Beginning, which is a 4 to 8 week program in Chantilly. We have Cornerstones, which is a longer term program for people who have more serious mental health conditions as well as substance use disorder. We have Crossroads, which is a longer term program for individuals with both substance use and mental health. And then we, of course, have New Generations, which will be coming back online in September, which is for women and children. We also do have a residential detox program, which is in Chantilly. And we have outpatient detox, which provides medication-assisted recovery. So many individuals with substance use disorder and perhaps co-occurring disorders really benefit from having Suboxone or Vivitrol or another medication to assist them.
I learn more about CSB every time I talk.
And we have more questions trickling in. The next question is, if the individual has private insurance, can they still go to the Merrifield Mental Health Center for an assessment?
Yes, absolutely. Thank you for that question. That is one of the myths, is that the CSB does not accept insurance, and we actually do accept insurance. While we receive generous funding from the county, we of course want to, get other revenues so we can serve more individuals. So yes, absolutely. And if someone does go to the Merrifield Center and is told that we don't accept insurance, I would ask that you please let me know, and I'll give my number out to folks, because that really is a myth and we want to get the individual served. We're not able to serve each and every person because of capacity issues. However, we do want to make sure that we provide a service, even if it means we're referring someone somewhere else, but we absolutely do take insurance.
Thank you, Lynn, for the clarification. The next question goes, also, are there any support groups available for caregivers?
For who?
Caregivers.
Oh, for caregivers.
So for us, we do have support groups that aren't, and we call it family groups, but we do have support groups that aren't necessarily for a mother, a father, or a direct family member. We do have support groups that are more for a different caregiver, or we have a friends and family as well. So we have friends of someone who's dealing with a mental illness. And that's actually how I found out about NAMI.
Thank you, Rebecca. This question is regarding CSB. Do you assess over the phone instead of walk-ins? And do you have any other languages available for CSB and NAMI?
So yes, so for the Community Services Board, we have found through COVID that some people do prefer telehealth. So we can offer a telehealth assessment. And I can send the phone number so we can schedule that if that's what someone prefers. We prefer not to do over the phone because it's hard to be able to sort of have that interaction in an assessment capacity. However, at times we've needed to do that because not everyone who contacts us has a smartphone with that ability. So we can look into that. And I'm sorry, I lost the second part of that question.
The second part is, do you have any other languages available for CSB and NAMI services?
Thank you. I'm so sorry I forgot that. That's such a key question. We do have some bilingual and bicultural staff. Unfortunately, we don't have nearly enough. We are working very hard to try to find individuals who speak languages other than English to match our community. What we can offer, and this is not our favorite thing to do, but what we can offer is the use of a language line. We really would prefer that we had the bilingual, bicultural staff, particularly when Rebecca was talking about the issues such as trauma. That's, more difficult to discuss with a language line. However, we can provide a language line, and when possible, we do provide a bilingual staff member.
In terms of NAMI services, we're actually starting 2 Spanish support groups, Spanish speaking support groups, one a young adult and one for adult family members. Again, Spanish speaking is not the only obvious one in Fairfax County. And ours is being determinate on the volunteers that want to come. That is, I've been executive director for 4 months in a week. And that is our primary goal for the next 12 to 18 months, is moving into other communities, and whether that's underserved, underinsured, or other languages. That is our primary push. So if you speak another language, if you're part of an underinsured, underserved community, and you'd like to be a part of NAMI Northern Virginia, info@nami-nova.com org, let us know.
Thank you, Rebecca and Lynn. The next question, are there national programs to help for families? I'm sorry, I guess there's a typo here. Are there national programs to help families support family members with dementia?
So I don't know. I think that's a great question, and certainly we can get some information back out to this this group of folks, but I don't know off the top of my head, but glad to look into that.
Okay. Is there any income guideline for CSB services? This is a nice question.
So we offer a sliding scale, and if individuals make less than a certain amount of money, which I'm sorry, I'm not recalling right now, the service is at no charge to the individual. We do have a fee schedule, and I'm also glad to get that out. So what I'm envisioning is sending a bunch of documents that will get sent out to people here, if that's all right with everyone.
Thank you, Lyn. We have another question, and it says, is there a suggestion you have for how to get a loved one help when they truly do not believe they are sick? I do not know where to start if they do not see it.
So that is really, I feel the emotion behind the question, and I'm really thinking about the person who asked that question and everyone in attendance. Sometimes they're really, it's very difficult, and what we've seen that has had some success is finding a very small window and acting on that window at that time. So, and it's a repeated discussion with the individual about perhaps coming into emergency services or coming in for an assessment, but it definitely is not easy at all. Other people have asked their loved one if they'll just come and sit at the peer support center and see if there's any help that can be gotten there. But really that is really a very challenging question. Not sure if Rebecca has any better answers.
Yeah, yeah, that one. I think the best thing that we can do, that anyone can do, is make sure that you're offering the most support, and watching what their signs are. So number one, you're not in harm, they're not in harm, and that's, you can't force an adult into treatment. The best that you can do if it's a loved one is to make sure that they don't harm themselves, the best that you can do. And that's something to always keep in mind when you're helping someone who might be in crisis, is you have to manage your safety and you have to manage your personal self. You can't help someone if you're not safe and if you're not in a good mental place. And again, it's that oxygen mask. I love that analogy. You have to take care of yourself, and after that, you can help with their safety. And sometimes that's the best you can do. And make sure that you are offering your support. Make sure they know you're there. And we say that in terms of suicide as well. Asking someone if they are going to hurt themselves or if they're suicidal is not going to put that thought in their head. Instead, it might be that lifeline that they need, just to know that you're there and that you care. And just let them know you care.
Thank you, Lyn and Rebecca. We have another question. It reads, do you have opening positions for career support? This is what I am passionate about in helping getting jobs.
Oh, so our employment support, yes, supported employment. Employment is actually an intervention in and of itself. One of the things, as Rebecca was speaking, I was thinking to encourage the individual into their hobby, volunteer work, employment. We do work with people, both contracted staff as well as CSB staff, who do provide employment services to our individuals. So yes, we do have that. And there's also other agencies in the community who do that.
Okay. This is our last question. Is there an email to use later when questions come up? Is there someone to email back and forth, like phone calls or for any other support?
We get this question a lot, and I know as a family member or as a loved one, you want that back and forth communication. And, and I know that that's often very hard to not have that back and forth communication. You know, Lyn was great about talking about HIPAA, and make sure that if you're the person that you're supporting is willing to give you the right to ask questions, make sure that they do in whatever situation that you're in. That's going to enable a lot more communication, because unless you have that, you can't get all the information that you really want. There's still communication that you can have. You know, other countries, they promote more of family members being a part of the process. We have such, and it's a good thing that we have this ability and these protections, but at the same time, a lot of mental health practitioners are going to tell you, you know, that support is also really beneficial in treatment. So if you have someone that is willing to give you HIPAA rights and privileges, then make sure you get those.
One other thing I was going to suggest is that with the classes and the groups that Rebecca was talking about, many people develop some real strong relationships with others in those classes, and that could be a great source of support.
Thank you so much for your questions. We are getting ready to wrap up. And as you sign out, there'll be a brief survey. Please take a moment to answer those questions and help us provide topics that you are interested in. Lyn, thank you so much for sharing your knowledge and expertise with us today. Rebecca, thank you so much for sharing those wonderful resources with us too. And to everyone in our audience, thank you for being here. Our next caregiver webinar will be on September 21st from 12 to 1 p.m. on what legal tool is right for me and my family. We hope you can join us then. Have a good afternoon, everyone. Thank you.
Thank you.
Bye.
I'm going to share my slides.
Okay,
Thank you.
thank you.